All over the world, pregnant women deal with the lack of access to health systems and qualified prenatal care that guarantees the health and that of the baby. Inequalities in access to high-cost technologies, healthcare facilities without resources, and misinformation are critical problems in many places in Brazil and around the world, which lead thousands of mothers to arrive at the time of delivery without even knowing their gestational age. On the day of birth, the age of a baby corresponds to the duration of the pregnancy, and find out when this pregnancy is correctly dated can make a difference in the health and development of this child. When a baby is born before completing 37 weeks of pregnancy is called premature. Complications of prematurity are the leading cause of infant mortality worldwide. Recognize as soon as possible that a baby was born prematurely and his special care needs can prevent several diseases in childhood and lifelong. The date of the last menstrual period is the reference for gestational age calculation, or when it's not available with the support of an obstetric ultrasound assessment. But finding out this age is not always easy when there is no antenatal information or after birth with clinical exams that indicate the physical and neurological maturity of the newborn, as they have a significant error. Surviving or not on the first day of life depends on the right measure of healthcare delivered, and the gestational age is essential information at that time. Proper care can increase a premature baby's chance of going through the critical moments of the first day of life. All babies deserve a future, and new technologies, when accessible and effective, can reduce the inequalities determining different chances of survival. A new technology developed by researchers at the Federal University of Minas Gerais in Brazil can accurately estimate the age of a newborn using a device that analyzes information from the baby's skin. It was designed for low-resource settings where preterm birth occurs more often, and at the same time the uncertainty of the pregnancy chronology remains a challenge. An exam is performed on the newborn with a medical device that uses light to assess the composition of the baby's skin. The device processes the signal with other information such as birth weight using artificial intelligence algorithms. With prompt results, the gestational age information helps health professionals choose the special care to deliver for the baby in the first hours of life. A scientific study in 5 Brazilian hospitals with 781 newborns showed that for every 100 babies, 91 were correctly classified as premature or not by the new technology. Another collaborative study involving Brazilian and Mozambican hospitals evaluated 305 newborns from a particular group called low birth weight. These are babies born weighing less than 2.5 kilos and therefore at a higher risk of complications than others. The device detected 96 of premature babies. The medical device, called the Preemie test, is easy to use and can be operated by any trained professional. This finding brings hope that the test can directly help the caregiver in a place without any information about the gestational age. The technology was recognized in the World Health Organization's compendium as an emerging technology for low-resource settings. In the future, we want the device to be everywhere where childbirth occurs without the gestational age being known and reliable. In addition to the equipment, the Preemie Care application offers universal guidelines to help with the baby care. It is available for free in the web app stores.